I was walking down the stairs and like just missed the step, and from there it just tumbled.
I'm sorry to hear that.
It hurts right here now.
Okay. Gently gonna feel along the thumb here. Okay. Index finger there is definitely showing some signs of swelling as well. Good. Does this feel about the same?
Mm-hmm.
And no difference here in any of the fingers. Thumb feels exactly the same.
Mm-hmm.
Good. Okay. And you can tell that this is sharp.
Yes.
Same sharpness. Good. And you can feel me touching your hair.
Yes.
Good. So I do see some distension here. In here. In here. Okay. So we are right about medial there. Enough for me to see it.
Like about there.
Okay, okay, good. Cleanse the area mostly at the injury site. Okay, perfect. Securing strip this way. All right, Samantha. So we have done your initial assessment and I am ready to go ahead and get you casted. So in order to do that, we need to prep the skin completely. Okay, so I know you're in a fair amount of pain. I'm gonna try to take it easy and obviously not be too firm. It is important, however, that we cleanse the skin thoroughly to remove any bacteria that could possibly be lying on the skin so that it's not just kind of sitting there festering, as you won't be able to clean it while you have the cast on. Okay. So I'm going to start by just putting a towel down. So we'll just have you rest your hand on that for me. Perfect. And just put your hand in whatever position is the most comfortable, which I realize is probably none of them, but I am going to start by putting on a pair of gloves. Now, for the purposes of this procedure, I want it to be cleaned thoroughly. I am going to be applying sterile gloves so that I don't potentially infect you with any bacteria that's on my hands. Obviously, my hands have been cleaned, but still. So I'm going to go ahead and put these on. right, Samantha. So now that I have my jacket and my gloves on, we can go ahead and proceed with the preparations. So let's begin with a simple cleansing solution. Now this is just sterile saline water, so this is going to be just a general prep, kind of get away any debris before we move on. So this is just a little bit cold, so I'm just going to go ahead and cleanse the area mostly at the injury site. Just make sure I got all of that out. Just try that off. Let's let that air dry a little bit. Now, you don't have any allergies to any kind of surgical prep, CHG, soap, anything like that?
No.
Okay. So this is just a chlorhexidine prep applicator, so it's going to come out orange. It will wash off. It's not going to stay in your skin. Just get it mixed up here. So we'll start to turn the sponge orange. Okay, perfect. So I'm going to go ahead and cleanse the area. It just kind of smells like alcohol, so just a warning, you're going to smell some chemical smells. And we are going to clean the entirety of the site, so everywhere that the cast will cover. And this is an antimicrobial as well as a surgical solution, so it is going to completely disinfect the area. This is causing you any discomfort?
No.
Just let this side dry for just a second. If I could have you rotate your hand for me, just take your time. I'm going to cause you too much discomfort there, so I'm going to let that sit for just a second so it can dry. Shouldn't feel any stinging or burning or anything, but it can feel just a little bit sticky. Alright, so this last step is barrier film. So essentially this is just going to provide a layer of protection between your skin and the cast itself so that none of the chemicals from the plaster can infiltrate, penetrate the skin essentially. So This is CHG compatible, so it's not going to undo any of what we just did. So I'm going to slide this across the skin. Would you rotate your hand for me one more time? Now this one for sure can leave a bit of a sticky residue, so it does go away after it completely dries, but initially it can be just a little bit cumbersome. All right, so now that we have thoroughly prepped the area, I'm going to let you sit for just a second while I go ahead and prep our plaster and supplies to get you casted. So give me just a couple minutes here, okay?
Okay.
All right, Samantha, I have everything prepared, and now that we've thoroughly cleansed the area, let's go ahead and get started with the casting. It does set fairly quickly, so I'm going to lay this up underneath your hand here, and we will go ahead and begin with application. Now, it might feel just a little bit odd. Obviously, it's kind of wet and sticky, not the ideal sensation. We will go ahead and begin with application here. It is a little bit warm. It's not going to cause you any pain, but just a fair warning. So I am going to begin this way. Now we typically overextend just a little bit. The movement here, just ensuring that we get a good fit. Okay, so I'll leave this one. So this isn't going to be as snug of a fit as a more long-term cast would be, but it does provide enough support to inhibit mobility, which really is the goal. Bottom pieces are a little bit warmer, so they are kind of insulating each other. Okay, so I'm going to have you rotate your arm for me if you can, just like that. Slowly. This one I'm gonna fold. So this will be a bit of a brace for the thumb to kind of hold that in place there. Now I will say, of course, with anything that's being applied to your skin and is going to sit for several days, it's going to be a little bit itchy, just a fair warning. Okay, so I know that can be kind of annoying. I don't recommend sticking anything inside the cast to scratch. I have had patients do that. Oftentimes results in infection, so you don't want to stick like a pencil or anything down there and potentially scratch your skin, because you're not able to cleanse the area because it can't get wet. You're then just leaving bacteria to kind of fester. So definitely don't recommend that. If the itching becomes unbearable, you can take something like a low dose Benadryl to help a little bit.
Okay.
Okay, so that is fairly secure. I'm gonna have you rest your hand down. It will weight as much as you can, and that will help it set on the back end. So typically only takes about 15-20 minutes for it to fully harden. Okay. All right, Samantha, so got about another 15 or so minutes before this is gonna set completely. So I'm gonna let you sit here. Try not to mobilize at all, so just keep your arm where it's at. I will have the medical assistant come in and check on you in about 20 minutes. If she feels that it's been set enough, she's gonna go ahead and put you in a sling. So I'll just show you. So she's just gonna place a regular temporary sling. It's gonna just help keep your arm in place, okay? So you don't have to wear this all the time. I would recommend that you wear it at least for the rest of the day. This is gonna feel a little bit heavy as well, so it'll just kind of help with the weight of that. So she will help you put this on as soon as this is ready. So I am going to step out. I've got some dictation to catch up on. If you have any questions before she comes in, you can just hit your call line.
Okay, thank you.
Thank you so much.